An additional poster I presented here, or that's a talk I presented here, is the question, now that we have looked at weight and said, okay, the weight is not the main driver. That's not an important difference. If you reach remission, that's fine. If you gain weight and reach remission, that's fine. But different. So looking beyond weight, it might be timing that's important. So that's another question we asked ourselves. Is it better to reach prediabetes remission early, or does it have the same effects if you reach it later on? So we compared, again, in the prediabetes lifestyle intervention study, those responders that returned to normal glycemia at an early time point after 6 months, and compared them to the participants that reached remission after 12 months. And comparing these two to the participants that never reach remission, both have a protective effect, so they're better protected from type 2 diabetes. But the group that reached early remission was even better off than the ones reaching later remission. So early remission seems to be an important target, and we still dive deeper into this concept. There's the notion of even earlier detection of type 2 diabetes risk by the International Diabetes Foundation. They proposed a 60-minute glucose cutoff during the oral glucose tolerance test. And you can use this to diagnose people with a elevated risk of type 2 diabetes even before ADA criteria of prediabetes apply. And if you start a lifestyle intervention in these people, so even before they have prediabetes, they have this new biomarker, this 60-minute glucose that's elevated, but everything else is normal. You do a lifestyle intervention in those, they are very effectively protected from type 2 diabetes. And this ties into the notion that early remission is very important. And to achieve that, we have to improve early detection, right? So that's another thing we're working on. Regarding your question about different research directions we're going into now, it will be important to clarify sex differences, right? To look if the mechanisms and the protective effects are the same in men and women, and also looking a bit more in detail, what's the role of ethnicity, right? And yeah, we're doing that. We're cooperating with people from all over the world, cooperating with people in India, in China, in the US, definitely, and I think this is a vibrant field and exciting stuff is happening. Yeah. The most important part is to be aware that early detection matters, and to be aware that remission is attainable, right? It's a target that's worth striving for. And also, I think having this in mind, providing people with resources, they can help that the patients help themselves. And there are many, if we look at digitization, there are many apps available that help you with this lifestyle intervention. I don't know how it is in the US, but in Germany, you can even prescribe some of these on a recipe. You can give it to the patient and they can download the app. It's a prescription, and these resources are available. So the main takeaway would be awareness, and then remission is attainable, and it's a good target to strive for.